So, I would like to ask for your permission to use this video for educational purpose and on internet. Do you have your permission?
Yes, yes.
Okay, thank you. Now, you had lots of pain, especially in your legs before the surgery. How bad was your pain before the surgery?
Well, it was a point of the numbness and the tingling but then when it started coming up my leg and all the way up to my hip,
Yeah,
it got to be almost impossible.
to
So
live
that's
with,
when
yeah.
I
Yeah,
needed to do something.
yeah. And I remember you and I, we have been seeing each other for almost 2 years, and we hold off on the surgery for a while
Yeah,
because you were not only that, we put you through our protocols and so on, but you were as well scared of surgery. Why were you scared of the surgery?
because of what I knew other people who had surgery, back surgery,
Mm-hmm.
and they still had a lot of pain.
Yeah,
But
yeah.
after I had the first surgery that you did 5 years ago,
Which was a decompression. We just took a
yeah,
pressure off the
yeah,
bone. See, you had a scoliosis. You had lots of bad disc, bad bone, but we always decide to do the smallest possible surgery that can give people maximum benefit. So 5 years ago, we actually opened up the nerves and gave them a little space. So what happened after the first surgery?
it was fine.
Good, for a while.
Yeah,
For a while.
yeah, it lasted 5 years, and you were surprised because
Yeah,
you thought I'd be back sooner.
because you had a quite significant scoliosis actually.
Yeah,
And even though you had a scoliosis, many of my colleagues say the only way to fix a scoliosis is a horrendous big surgery. We decided to do a small surgery, just take the pressure off,
hmm
and that worked for a while, but the pain came back. When the pain came back, how bad was the pain? Pretty bad, I remember.
Well, at first it was just off and on and tolerable, and
Mm-hmm.
I think I can tolerate pain pretty well.
Yeah.
But it kept getting worse, and then, like I say, to the point where
Yeah.
I needed to do something further.
And we did that surgery, what, about 4 months ago? When did we do that surgery?
4 months.
Yeah.
Yeah.
And you
it's-
just stayed one night in the hospital, is that right? You went home next day, is that correct?
Yes, I had the surgery on the 4th, and I went home on the 5th, shortly after dinner. Well, I went right to the villa for therapy,
Yeah.
and I
And
was there for 6 weeks.
okay. But I see that, here we have actually, what we did is a scoliosis correction. We did it in the L3 to S1. You had some additional problem, and you still have. But we decided we don't want to fix everything at once. We want to do the smallest possible surgery that can give you maximum benefit, and that was fixing the bottom tree. In the bottom tree, the scoliosis is gone. Above it, there's still some problem there. But how are your symptoms now? How is your pain? Zero? No pain anymore?
When I started feeling this out, I put 1, but that pain has not come back, and
Yeah, excellent. Now, how old are you?
86,
Excellent. A good
Going-
86.
going on 87.
Excellent. But in this age group, big surgeries are very dangerous.
Yeah.
That's why an open surgery would not be an option for you. Yeah.
No, I wouldn't have taken it.
Yeah.
I wouldn't have taken it.
And you told me as well from your friends and you're a nun. Is that right? You're a sister.
Yes, I'm a sister of Saint Benedict.
Excellent. Well, thank you for all your service and but you have as well probably know lots of people who are in a similar situation who need kind of spine surgery. Is that correct?
Yeah, there are other people who have back problems.
So what do they tell you? People who have done other surgeries, other kind of surgery.
Well, they were very interested in when I told them what.
Yeah.
what
No, but
happened.
what do they tell you about the surgeries? If they have gotten any open surgery, any old-fashioned surgery, what do they tell you about the recovery? Because you told me before that you
Well,
heard of many people that they weren't really.
Yeah, some have had 2, 3 surgeries and they still have a lot of pain.
Yeah.
So that put the damper on
Yeah.
wanting to have a back surgery.
That's right. That's right.
So
But fortunately, you didn't get that open old-fashioned surgery. We did your surgery in less than 1.5 hours. As a matter of fact, a professor from Japan was observing your surgery. He was very impressed.
was it my surgery?
I think it was in your surgery.
Oh, yeah.
Yes. That's why we got the permission from you to use that for educational purpose then when you had the surgery. So he was very impressed, and I'm going to send him this video showing him how you are doing 4 months after the surgery. But overall, how is your daily activity? How is your pain? Your pain, you told me, is 0. But how is your daily activity? Are you happy so far with the result of the surgery?
Well, I'm glad I did it. I'm glad I did.
Okay.
I'm glad I did. And glad
Excellent. Well, thank you so much for the interview. I appreciate that.